Hi guys, welcome back to my channel. I'm Dr. Veena, full-time NHS GP working in London, and today we're going to go through 5 warning signs of bowel cancer. By the end of this video, you should be able to name 5 signs to look out for if you're worried about bowel cancer, and we're going to take you through what tests and investigations to then discuss or expect with your doctor. Understanding and really appreciating what your body's normal cycle is really important, because that's when you can identify if something goes or deviates away from the norm. That's the first thing to really say. So just even knowing what's normal for you. Do you open your bowels every day, every other day? What's your normal? It's also worth noting that cancer can be present without any signs or symptoms. So even though we may go through this, sometimes it could be very insidious and we may not always be able to pick it up. However, these 5 signs are something you should not ignore if you notice them in your general health. Number 1, a change in your bowel habit. This change could be anything from diarrhea, constipation, or incontinence. It all depends on what is normal for you. And if you observe over a few weeks, things have changed, that's something you might want to discuss with your doctor. Number 2, unintentional weight loss or a loss of appetite. I say unintentional because if you're trying to lose weight and have been training really hard, of course you're going to lose weight. But if you've not been actively trying to do anything, you've just gone off food and have not been eating, and you may not even have realized that you're losing the weight. It might have been people telling you that actually you look like you've lost weight, or you might observe that your clothes are a lot looser now. That's really signs to look at what could be going on. So something you should pick up. Number 3, unexplained anemia. So if you have done routine blood tests and your hemoglobin is low or your ferritin levels are low and you're anemic, despite taking iron supplements, despite having treatment, this is something to discuss with your doctor, because you might be losing blood somewhere in the gut or in the bowel, and that's why you're becoming anemic. Anemia is when your hemoglobin count goes low, and we really want to find the source of why you might be anemic. So if that's the case, you might want to speak to your doctor as well. Number 4, if you find blood in your stool, specifically dark or black blood, this is something that you urgently need to seek medical advice about. More commonly, people find bright red blood on wiping, and majority of the time that's to do with hemorrhoids, which is not a serious concern and not the same as bowel cancer. However, any bleeding from the back passage should be discussed with your doctor. And number 5, if you've noticed a lump in your abdomen. Now, it could be a lump that's lower down near the pelvis or a bit higher up. It could be persistent and not moving, or it could be moving around. It could be painful or painless. But if you notice an abnormal or a new lump in your abdomen, it's something to bring to a doctor's attention. If you notice any one of these 5 signs and you go to your doctor, these are the things you can expect. Your doctor's going to ask you some more detailed questions around your family history, your general health, your social health. They may then examine you. The examination might be of your tummy. They might also need to do an intimate exam of your back passage to see if there are any lumps or growths there. They might add on some blood tests, and they may also do a specific test called a FIT test, which can pick up small amounts of blood in your poo that you may not have seen otherwise. If any of this comes back positive or with alarming results, the next steps would be that your doctor would refer you for a camera test. A camera test in this instance means a colonoscopy, where a thin flexible tube is inserted from the back passage that allows the clinician to visualize what's going on in the bowel. This will help us pick up any points of bleeding, any growths, any polyps, any tumors. That's how we would really identify and diagnose the cancer. Currently in the UK, there is an annual screening program for bowel cancer for 54 to 74-year-olds. This involves a small pot and a form where you provide a stool sample that's sent to the lab to see if they can see any microscopic blood in there. I say microscopic blood because when you look at your stool, you may think, I don't see any blood there. So this test is so specific, it can help identify broken down human blood in that sample, and that's how it works. So this test is actually a very specialized test. It's called a FIT test. It stands for fecal immunochemical test. What it picks up is broken down human blood. So if you've been bleeding somewhere in the gut, that blood gets broken down, and if traces of them are found in the poo, this test can pick it up. And that's how we then know that something's going on deeper in the bowel that we have to investigate. So if you have been given a bowel cancer screening kit, please don't ignore it. Make sure you do it and hand it in. We're seeing a lot of positive bowel cancer cases in young people as of recent. So if you have a positive family history, which means a first degree or a second degree relative who has any of these symptoms or were diagnosed with bowel cancer, I would really encourage you to seek medical advice and get regular screening as well by discussing it with your doctor. I hope this video helped you to discern what are the signs to really look out for bowel cancer, and it helps you navigate the next steps if you've been unwell in any way. Remember, this is not instead of an actual consultation with your doctor, so make sure you see your designated doctor to discuss your health in more detail. Thank you so much for watching. I'll see you in my next video.